Good morning. This is a present. My name is Teresa Kingemi. I'm the president and owner of Medicare Made Simple, LLC. I've been in business coming up on 7 years, and today's presentation, I will be educating you about Medicare, the system, what your options are, and how to choose between the different plans. I never talk about the individual Medicare plans or the carriers themselves. There's a lot of compliance issues that center around that. So, and I find, good morning, and I find that we're just starting. And I find that that people don't really, I mean, you know, as consumers, we want to learn, we want to be educated, we don't want to be sold. So what either my process or my mission is to educate a growing generation of people who are Medicare eligible about Medicare, how it works, what your three options with Medicare are, and how to choose between the different plans. So by the time we're done with this presentation, my hope and goal is that when you get all this literature in the mail, you'll be able to decide or determine by looking at the literature what is an Advantage plan, what is a supplement, how original Medicare works, and what is a prescription drug plan, what does it look like. We'll talk about the late enrollment penalties. We'll talk about the prescription drug gap or donut hole, and we'll also talk about how to stay away from the penalties. So a lot of educational material, a lot to go through. I'll try to keep it to an hour and a half, and the process as we go through this is I build on principle. So you'll hopefully by the end you'll know everything. And if you have questions in between, you know, like you need clarification or something, please feel free to ask. As I mentioned, so I look at myself as a consultant, an advocate, because I do one-on-one meetings. I also do seminars in the community. I was a keynote speaker for the Dementia Care Conference last year, and I also offer enrollment services. So I'm contracted with 9 different carriers to represent their Medicare Advantage plans, their supplements, and their prescription drug plans. I'm licensed for New York State, and when we meet either one-on-one or in a seminar capacity, we talk about options. So I'm educating about options, and if the time that we spend together, if you choose a plan or decide to enroll between the 9 carriers that I offer, I'll help you through that enrollment process. I'll submit the paperwork for you, and how we get paid as agents is we earn a commission. So we're paid by the carriers. I'm not fee-based. So the commission comes from the insurance company of the plan that you enroll in when you're working with a licensed agent in the marketplace. We're also going to, in other words, which is important to know, is I don't work for the federal government or any of the insurance companies. I work for myself as an independent agent, and my company is called Medicare Made Simple, LLC. So I'm celebrating almost 7 years in business, and I'm a Medicare specialist. So we'll be talking today about what is original Medicare, which is Part A and B. We'll talk about what the Medicare Advantage plans are and how to decide, or how they're comprised, how they're, you know, what are the co-pays, what's the difference between a PPO and an HMO. We'll talk about the Medicare supplements. We'll talk about the prescription drug plans. We'll also talk a little bit about EPIC and why it's important. And we'll also talk about Extra Help, which is also called the Low-Income Subsidy. And that program, these EPIC and Extra Help, those are 2 programs that help you with the cost of your prescription drugs. Okay, and they are income-based, so we'll talk about what those income limits are as we get more into that. This is what a Medicare card looks like. It has your name on it. Okay. Your claim number generally is your social security number. If you're working off your work history, your 10 years, 40 quarters or more, your social security number will have an A after it, meaning or depicting your work history. If there is a B after it, it means that you haven't worked enough, you haven't worked 10 years, 40 quarters or more, and maybe you're working off a spouse's work history. If it's a letter T after your social security number, T means that you've delayed taking social security, but you're eligible for Medicare. You've delayed taking your social security benefits, and so they depict that with a T after your social security number. Sometimes they see a D if you're working off a spouse's social security benefits or work history, and your spouse is deceased. Okay. Good morning, good afternoon. No, we're just starting, and there's some note paper there also. Also, what you'll find on your Medicare card, Part A and Part B, these are your effective dates when most people know Part A covers hospitalization and Part B covers doctor or medical. So Part A and B could have two different dates. They don't necessarily have to be the same. I mean, you could turn 65 and enroll in Part A, but because maybe you're still getting insurance through an employer or you are getting insurance through a spouse who's working, then good afternoon. Then then you could delay taking Part B under certain circumstances, and your Part B effective date would be different. Delay. So, for example, there's somebody in the room who, and I won't say who, who has a spouse who's currently working, and as long as that employer has 20 or more employees, then the group health insurance would be primary coverage, Medicare would be secondary. And so it's depicted on who's primary and who's secondary is based on how many employees an employer has. So if the group health insurance has terrific benefits, the premiums are low, maybe they're in that premium, they're throwing in dental and vision and hearing and the whole hoopla, then it might be more attractive maybe to stay there for a little while and maybe think about, when the spouse is no longer working, doesn't have that benefit anymore, maybe you're both moving to Medicare at that point. The other thing that you want to be aware of, and we'll cover this again in another slide, is if you're keeping group health insurance and you turn 65 and you're staying with the employer's group health insurance, you want to make sure that the employer's prescription plan is creditable, meaning it's as good as Medicare's prescription coverage. And sometimes people will quickly respond and say, well, yes, it is. Well, no, it doesn't work that way. You have to go back to the plan administrator and ask the question, is our group health insurance creditable? The drug plan creditable? Because if it is not, then you need to take a Medicare drug plan because there's late enrollment penalties associated with Part B and D, which if you don't put your Medicare or enter Medicare properly, those penalties will last you for the rest of your life. Okay, so it's a long explanation.